I first suspected I had a problem when I found a lump in my left breast, and I had a kind of a feel around on the other side as well, and realised that I'd got a lump in the right breast as well. So I then went to my GP and the practice nurse, and they referred me to the hospital unit. My first feeling, I was just a bit numb. My second thought was, okay, how are we going to deal with this? And then my third thought was, it's cancer.
My husband and I came to the Canterbury appointment, and I had the mammography done. After that, I was asked to go and wait in the waiting room for a length of time, and they would come back and call me. At that point, I still thought I was fine. I thought it was a benign cyst, possibly. I didn't even think it could be cancer. I wasn't prepared for breast cancer. So it was a little different. And also my family is all back in Canada. So it was a little tricky telling them.
I think my worst fear was telling my mother, and I actually drove up there, and I couldn't tell her on the phone. I drove up there and told her personally.
Every month, about 400 women are seen for a diagnostic mammogram in one of the hospitals in East Kent. What we would like to offer them is a new technology digital mammogram so that they can have their diagnosis made more quickly.
I think it's very important to be diagnosed very, very quickly. It's a stressful time, and you need to know where you're going, whether it is a positive or a negative diagnosis.
The new machines will be very important to any breast cancer patient, because the radiographers will be able to tell instantly whether they've taken a good image and be able to give it straight to the doctor, or they will have to take another image. At present, the patients have to go and sit in a waiting room and wait for 20 minutes or longer in order for the analog images to be developed. And then if it's not any good, they have to come back and have the whole process again.
There isn't a single working day that goes by when we don't diagnose breast cancer, and I would like to be able to say to every lady, we've caught this early and therefore you're going to have a favourable outcome.